Okay. And Kamar, you guys can take it away.
Amazing. Thank you, Alex. Hello, everybody. We are the In Touch Peer Health Advocates. I will be one of your two presenters tonight. My name is Kathleen. I am a fourth year UChicago undergraduate student, and I'm a creative writing major on the pre-medicine track, and my pronouns are she, her, and hers.
Hi, and my name is Mari Knudsen. I'll also be giving the presentation alongside Kat. I'm a third year environmental studies major, and I use she, her, hers pronouns, and I'm also a member of InTouch. So meet the InTouch PHAs. We are the InTouch Peer Health Advocates. As InTouch PHAs, we aim to create an honest and sex-positive environment to discuss sexual health and healthy relationships that is inclusive to all identities, experiences, and ways of having sex. We educate peers on sexual health, healthy relationships, and resources through workshops and events, aiming to empower them to make their own decisions about their sexual health and relationships. We combat stigma against sex and intimacy through open dialogue about personal and interpersonal wellness in order to thrive as a campus community. The UChicago Peer Health Advocates program is also home to two other peer resource groups, Body Talk, which focuses on body image and eating disorder awareness, and Mind Over Matter, which focuses on mental well-being and reducing mental health stigma on campus. And we as a group in touch is specifically knowledgeable and passionate about sexual health and healthy relationships and resources for both these topics.
So although we are new to conducting the InterCourse workshop remotely, this is an interactive workshop. So please feel free to unmute yourselves or to use the raise hand icon under participants. And also, if you're more comfortable just texting our anonymous Q&A line, feel free to text UChicago PHA 649 to the number 22333. And that way you can just join our anonymous Q&A and you can text us a question. And finally, you can also type into the Zoom chat box. You can do this publicly to everyone, or you could also do it privately at any time to ask a question, and we will get to it in this presentation.
I'll be shouting out the anonymous Q&A questions from the website that we use where you text in your questions. And then if people want to send in something private, they can send it to either Mari, Kat, or I, and then we'll discuss it in the group.
So our approach during COVID-19, given the new social distancing guidelines due to COVID-19, our approach to sex positivity, intimacy, and social contact is constantly evolving. We encourage students to follow the UChicago Health Pact and social distancing guidelines when making decisions about their interpersonal relationships. With that, we aim to create a safe environment in which no one ever feels ashamed or scared to seek out sexual health or healthy relationship resources that they need. We'll also be discussing more facets of consent that have arisen due to COVID-19. And we want to remind you all that sexual health and healthy relationship resources are still available to you, even though they might look a little different right now.
So in this workshop, we have a couple of goals. First, we want to practice respectful and effective ways of communicating in a healthy relationship. Then we want to learn the basics of hormonal birth control and barrier methods. And finally, we want to become familiar with the various campus resources about sexual and relationship health that are available to you, both as a student of UChicago and as a resident of Chicago. And if you look down there, that's a little drawing of an internal condom. And I will actually be showing you guys later in this presentation about how to use one.
So we also have a workshop roadmap. First, we're going to discuss important aspects of all healthy relationships. Then we're going to discuss communication in relationships, including consent, as well as starting difficult conversations, including those relevant during COVID-19. Then we'll dive into sexual health and discuss birth control and contraception, as well as barrier methods for STI prevention. We'll end with a condom and dental dam demonstration, as Kat mentioned, and a view of campus resources. The content and discussion in this workshop will include sex and human anatomy. We ask that you give these topics the respect that they deserve. We will also be talking about consent in the context of healthy relationships, including the mention of rape. We understand that this topic can be triggering, and if you need to step out of the Zoom meeting to take care of yourselves, we completely understand and encourage that.
So let's talk about what a healthy relationship is. Now, healthy relationships are based on mutual trust, support, and respect. All partners feel safe with each other, and this means that they're comfortable sharing their thoughts, concerns, interests, or differing opinions without fear or discomfort. Additionally, all partners are free to have a life outside of the relationship. So in a healthy relationship, partners actually encourage each other to see friends and do activities that they enjoy independently. This is something that a lot of people actually have to deal with or potentially address in college, because it's so easy to get very consumed in your relationship. And a lot of times it's very easy to lose yourself in one, which is why we're talking about it. So we hear this kind of language, healthy relationship language, applied most often into romantic or sexual relationships. But it's also really important to remember that we can think about any relationship this way. Relationships between friends, family members, etc. Those can all be healthy as well. And something we want to emphasize is open, honest, and continuous communication in a healthy relationship. This communication should at least involve your wants, your needs, your opinions, your preferences, whatever is important to you to make known. You also have a right to feel comfortable when sharing things about yourself and your life with your partners. These are just the basics, and we're going to go over a ton of resources to learn more about healthy relationships at the end of this workshop.
Okay. So healthy communication, as Kat mentions, take work and isn't always easy. Some conversations might be easier and other conversations might be harder, but there are some general tips that can make communication healthier. First, try to talk in person. Has anyone ever felt misunderstood over text, Snapchat, or online? I'm guessing probably everyone at some point. Texting, Snapchatting, and sliding into someone's DMs are great ways to keep up with what someone's up to, make plans, and just say hi. But if you need to talk about something that's bothering you, it's much better to plan to meet in person. This is because it's easy to misunderstand someone's meaning or tone from written communication, so it can lead to misunderstanding. Next, find the right time. If you want to talk about something that's important to you, pick an appropriate time so that your partner can really focus in on listening to you, not when someone's frantically studying for a midterm or rushing out the door. Make sure you're honest about how you feel. Your feelings and opinions are important and valid. In a healthy relationship, you don't have to hide how you feel from your partner. Finally, really listen. Make sure that you are really allowing yourself to hear and absorb what your partner is saying. This means never interrupting and avoiding just thinking about your response while they're talking. There might be pauses or silences, but that's okay. Now we're going to practice. So we're going to provide you with a scenario, and you can let us know how you would respond. So when you respond, feel free to type in the chat, unmute yourself, or raise your hand to participate, whatever. Your partner has been sleeping over a lot. You love them and you enjoy spending time together, but having them sleep over every night really disrupts your self-care routine that help you stay balanced during your week, such as having a consistent bedtime, getting your readings for class done at a reasonable hour, and getting up early enough to have breakfast before class. How would you address this with your partner? Does anyone have any ideas?
Hannah Bernstein raised her hand. Do you want to unmute yourself?
I can also put my camera on just to say hi. So, hello. I think that this is really like a complicated problem in relationships, but it's one that like comes up a lot. And I guess the way that I would address it would to be like setting healthy boundaries with my partner and saying like, this is just so that like I can love you more when we're together, and like it's not anything that's like about you, but like for me to be my best self, I need to take time for myself, and like framing it not as like an offense to them and spending less time with them, but framing it as just spending more time with yourself is how I would do it.
That's such a great response. Thank you so much.
That's amazing, Hannah. Thank you.
Thank you.
Yes, that definitely follows the tips for healthy communication. Okay, thank you.
All right, so now let's talk about consent. So this is one area that requires constant communication in sex and also in your relationship in general. Sex is consensual, and sex without consent is rape. Consent is verbal, it's verbally given, and although there are ways for somebody to non-verbally show you that they're into you, consent can only really be given verbally. Now, consent is required every time you have sex, no matter how many times you've had consensual sex with this person in the past. Furthermore, consent to one act does not imply consent to other acts or all other acts. Consent should be freely given, which means it's given without force or the threat or implication of force. Additionally, consent is revocable at any time, meaning that all people can always change their mind about whether or not they want to do something. So given that we are on a college campus, this is very important to talk about when it comes to alcohol and drug use. Consent is tricky. Legally, anybody under the influence of alcohol actually cannot give consent. So while we acknowledge that people do have sex while drunk, especially on a college campus, it's also important to acknowledge the difficulties and the risks that can arise. So there are some important questions that you should consider before having sex with somebody who has consumed alcohol. For example, are they completely in control of their body? Are they completely aware of their surroundings? Do they know where they are? Are they speaking normally, or are they slurring? If you're not absolutely sure the answer is yes to any of these questions, don't have sex with them. If they really do want to have sex with you at the moment when they're drunk, they will probably still want to have sex with you sometime when they're sober, and that poses fewer risks and fewer consequences for everybody.
Along those lines, consent isn't something that has to be robotic or awkward. Affirmative consent is fun and sexy. Some examples are, yes, I want you, more, and that feels so good. Notice that these are things that you would probably expect to hear or say during sex anyways. If you encounter any signs of non-consent, which would be like someone not initiating activities or becoming really quiet, and or want to be sure that your partner's active participation is enthusiastic consent, all you have to do is stop and check in. Your partner might just have their arm in an uncomfortable position, or maybe they really need the sexual activity to stop. Checking in does not have to be awkward or kill the mood. Some things you can say are, does this feel good? Do you want to? What should I do next? This can also open up the conversation about what your partner wants in bed so that you can have better sex in general.
So what does consent look like during COVID-19 in specific? Well, consent during COVID-19 goes beyond partner-to-partner conversations. This takes into account friends, roommates, coworkers, etc. And it involves discussions about what your comfort level is with your personal space, with your PPE, masks, gloves, etc., physical contact. And it requires you guys to answer these questions, like who are your close contacts and what kinds of safety measures do you and your close contacts have? Making sure that both parties or all parties are consenting to the answers to these questions is really important. So now let's try to practice. Again, we're going to provide you with a scenario and you can let us know how you'd respond. Again, with the raise hand option, you can also just unmute or type in the chat. Okay. So you're considering getting more serious with someone you like, but you haven't talked to them about who else they're seeing right now. About your expectations for COVID, your boundaries, your personal and public hygiene, whether or not you guys wear masks in public, how often you guys get tested. Haven't talked about any of that, but you still want to potentially pursue something more serious. How would you start a conversation about these topics given the global pandemic with this person that you like and you're interested in pursuing something more with? It's a tough question, so feel free to take a little bit to think about it.
And you don't have to shout it out. You can also type in the chat if you have any ideas. Maybe you've had like past experience with having this conversation, as we all have had to navigate a lot of different situations right now. I can also throw out a suggestion. I would say that I would start by telling this person that I've really enjoyed getting to know them over the past few weeks, and I really enjoy the ways we've been spending time together, either over text or Zoom or through a social distance meetup. And I'd like to see them. I'd like to just clarify my boundaries and how I expect people in like kind of my pod, what I expect in terms of like COVID guidelines and like mask wearing and stuff like that. Just be clear about what my boundaries are, and then kind of ask them what their boundaries are, and then make sure I'm not like attacking the person or saying like, this is what you have to do. Just saying if we were to maybe take a next step in terms of like seeing each other, that these are my boundaries, and I would see if we have them in common.
Thanks, Mari. That's great. Yeah, I feel like you bring up a super important point, which is, say you guys have different boundaries. In a situation like this, where you might still want to pursue something romantic or something just simply non-platonic, then finding a middle ground would be great. Maybe instead of hanging out in person indoors, you guys could arrange weekly FaceTime meetups. Some way to build that connection and build that empathy, that intimacy, not empathy, but without risking either of your health. So then I think we can move on.
So back to talking about, so checking in does not have to be reserved for in the bedroom. Talking about sex, especially sexual preferences, can be awkward. However, chances are your partner will really appreciate your openness, and you will be able to open up new conversations about your sex life, and maybe even start having better sex. So remember to start with open-ended questions, set a tone of non-judgment, and clarify boundaries when necessary. So we have some more scenarios. So you're a person with a vagina and you've decided to get a prescription for the birth control patch. You tell your partner who has a penis and they immediately say, I'm so excited to not use condoms anymore. You actually would like to keep using condoms for extra protection. How would you respond? So again, you start a new prescription and your partner wants to stop using condoms, but you'd like to keep using them. Anyone have any ideas for what you would say in this scenario?
I'm sorry, I don't know how to use the hand raise function. Can I just like speak?
Yes, please.
Well, if somebody's not comfortable with something, you have to always respect that. So they should keep on using condoms. I think that's the right answer and the only answer.
Yes, totally. Do you have any ideas for what you would say, maybe if you were like the partner who would want to keep using condoms in this scenario?
I'd just say that, you know, because maybe your partner would try to be rationalizing it, saying, oh, we won't get pregnant. But I mean, that's not necessarily the only reason why you would wear a condom. That's probably.
Totally. Yeah, and we're going to get into that. Yeah, another important reason you might want to use a barrier method is to prevent STIs. So we're going to talk about that soon. Thank you so much.
And also, oh yeah.
Yeah, go for it.
So I was also just gonna like interject and say that like condoms, like Oliver said, like also prevent STIs, or someone said that, but I feel like you should, if someone is in that situation, or if I were in that situation, I would frame it as like, this isn't even about getting pregnant, because birth control doesn't protect against so many other things. And like, you should also, if you're trying to like have sex without a condom, like that doesn't just mean that you should be on birth control. That also means that like the person who's saying that should be tested, because they can just give you STIs. So I would be really upset if someone said that to me.
Yeah.
But I feel like I would try and frame it as like, this isn't just like about pregnancy. This is also about my own health. And like, I'm getting serious with you, and I like don't know what your STI situation is and stuff like that.
Yeah, you guys are so on the ball. This is amazing. Also, I just saw that somebody sent to the chat, and this is 100% accurate. They said that I would also say birth control isn't 100%, which is perfect and actually segues directly into our next slide, where we're going to talk more about sexual health. Okay, so when we're talking about sexual health, we should define it. Communication about sexual health is really important and allows us to think about our own as well. So protecting our sexual health, as we've brought up briefly, broadly means doing what's necessary to feel safe and comfortable and stay healthy while having sex. Now, this encompasses preventing STIs, as we mentioned, as well as unplanned pregnancy, which was also brought up. So we're going to go over hormonal birth control methods, long-acting reversible contraception, emergency contraception, pregnancy, and abortion. We're also going to talk about STIs and STI prevention, as well as barrier methods with our demos.
Okay, so first let's start with hormonal methods. So hormonal methods work to prevent pregnancy by releasing hormones to inhibit ovulation, fertilization, and implantation of the egg. If you're a person with a vagina and you would like to start using hormonal birth control, there are a lot of options to consider, and you can see the options pictured on the screen. So we have the pill, which would be prescribed and you would take daily. There's also tons of different kinds of pills, like variations of the pill, but that's just one general category. There's the birth control shot, which you would get every 3 months at a doctor's office. You have the patch, which you would switch out weekly. And then there's the NuvaRing, which you would switch out monthly. So hormonal methods are great for preventing pregnancy because they're very effective and don't need to be messed with immediately before or during sex, unlike some barrier methods. These methods do, however, require prescription from a doctor. And considering like that we're all staying home right now, there's actually a lot of ways to get this prescription online. And we can talk about those at the end. Another thing to consider with hormonal methods is that they can have side effects, both positive and negative, that differ from person to person and by which method. So it's really important and helpful to talk to your doctor about which method is right for you. Also, remember that although hormonal methods do work to prevent pregnancy, they do not prevent transmission of STIs. And you guys actually knew that in the last scenario. So the UChicago Student Wellness Service offers all students free contraception consultations where you can discuss your needs and, if you would like, receive a prescription for the method that is right for you. And that's covered under the student health fee. So or student life fee. So that's even if you don't have U-ship, that's covered. And so does anybody have any questions right now about, I can go in more depth about any of these methods. Otherwise, it's just good. We can move on. And people can ask questions at the end.
I also re-put in the, oh, sorry.
Oh yeah, I was just gonna mention that we also have, yeah, so we have this chat where you can see that you can text your anonymous questions, and you can also come up with any later on, and we'll also get to it. You don't have to worry about us not coming back to this. It's a super important issue. We're gonna bring it up a couple times as well. I noticed that somebody mentioned that there's also IUD, And that's actually something that we're about to get to.
Mm.
So an IUD is one of the long-acting reversible contraceptives. So I'm just going to call them LARCs from now on because that's a friggin' mouthful. But they are the most effective forms of reversible birth control. So LARCs include copper IUDs, hormonal IUDs, and the implant. And each of these methods is more than 99% effective. So if you're worried about the effectiveness of, say, the pill and that little slim margin of opportunity for you to get pregnant is actually a little bit too high for you to personally risk, these are a great option. The hormonal IUDs and the implant work just like other hormonal methods, such as the pill, and the copper IUD kills sperm to prevent pregnancy. That's because copper as an element is actually a spermicide. Additionally, after they're inserted by a doctor, each of these methods can last for a very long time. The implant can last for up to 4 years. The hormonal IUD can last up to 5 years, depending on which one you get. And the copper IUD can last up to 12 years. However, just like hormonal methods, they do require prescription and they do not protect against STIs. So if you guys have questions about this, I would love to hear them. We have a lot of information on them and we can go more in depth about them as well. Or you can message the chat or send us an anonymous question and we'll also get to that.
Yeah, and also if anyone's really interested in learning more about birth control methods, we're going to have a whole panel about them next quarter. We're going to have representatives from hopefully Howard Brown Health, Student Health, and Planned Parenthood, as well as a bunch of other places. So it's a great stay in touch with our with our Facebook page if you want to check out more. Looks like nobody has any questions about this, so we can move to the next slide. So after unprotected sex. So if you have unprotected sex or experience a contraception failure, you have options. We encourage you to talk to a doctor about what options are best for you. Additionally, emergency contraception is time sensitive, so the sooner you are able to take action, the more options will be available to you and the more effective they will be. Emergency contraception can prevent you from becoming pregnant. So it's not an abortion, it's different from abortion. It will only prevent you from becoming pregnant if you're not already. Sometimes that can get confusing. There are a few different options. A common form, which you may recognize, is a pill called Plan B with high doses of hormones that should ideally be taken within 3 days after unprotected sex. It is available over the counter at places like CVS, which is on East 53rd, or Walgreens, which is on East 55th, for about $50. However, if you call Chicago Student Wellness, they can give you a prescription that will decrease the cost. Another option is Ella, which is another emergency contraception pill. Ella is available at Chicago Student Wellness as well with a prescription and is often free with insurance. Some research has shown that it is more effective for people with a higher body weight. You can also have a copper IUD inserted up to 5 days after unprotected sex, which is a super effective way to reduce your risk of pregnancy by 99.999% and also provide long-term birth control for the future. So there's lots of different options.
We also have an anonymous question from the texting thing. So it's, how does an IUD affect your period? So basically all hormonal types of birth control have different side effects that differ from person to person and also differ from the type that you use. So there's no definite side effect on periods, but hormonal IUDs may make your periods lighter. And some people with hormonal IUDs don't get their period at all, actually. And then with the copper IUD that doesn't have any hormones, they can sometimes or often make your periods heavier or you experience more cramps sometimes. But again, like none of this is really specific to a specific type of hormonal birth control. It really differs based on what type you use, but those are some of the effects on someone's period. Thank you for the question, it's really important.
Yeah, birth control can, at least what I've found, and like a lot of my friends, that it often takes a lot of trial and error to find like the best method for you. But there's tons of resources out there to help you.
Thanks, Alex, for answering that question. So what happens if you do become pregnant? If you become pregnant, there are multiple options to consider when making your decision. Should you choose to get an abortion, there are two methods. You can either take a pill prescribed by a doctor, which is actually 2 pills, not just 1 pill, or you can undergo a medical procedure performed by a doctor. Both of these options are available at locations around Chicago, including Planned Parenthood clinics or UChicago Medicine. And also, it's interesting to know, actually, and a lot of people don't know this, that abortion services are actually covered under USHIP with a referral from a doctor. So another option is to carry the pregnancy to term. So counseling and resource referrals are available at UChicago Student Wellness. Most family planning and women's health clinics also offer these prenatal services, such as Planned Parenthood and the Chicago Women's Health Center. Prenatal care is also available at UChicago Medicine, very close and handy. Mm-hmm.
Okay, so now we're going to switch gears a little bit. So even if the kind of sex you like to have can't result in pregnancy, you still need to think about protecting yourself from STIs if you have sex. STIs are passed between people during vaginal, anal, and oral sex, or by sharing sex toys without cleaning them. Common STIs are chlamydia, gonorrhea, herpes, and HIV, but there are many more. Some common symptoms include discharge, painful intercourse, painful urination, swelling, redness, or sores. However, some STIs are asymptomatic. The most common symptom of an STI is actually no symptom at all. Also, someone could have any number of these symptoms and have something that is not an STI. So the only way to know for sure if you or your partner has an STI is to get tested. And if you notice anything unusual or painful, go see a doctor. So now let's try some true or false about STIs. So number 1, sexual intercourse is the only way to get an STI. Is this true or false?
You can just message the chat if you want.
Or just shout it out if you want. Be brave.
False.
Yes, that is false. They can be transmitted. They can be transmitted orally in many cases, or more rarely through genital rubbing or skin-to-skin, any kind of skin-to-skin contact. So it's important to use protection during all kinds of sex acts. Okay, number 2, if I get chlamydia, I'll have it forever. Is this one true or false? Anyone know? Looks like someone's in the chat. Oh no.
Sorry.
Well, this one's false. Thank you, Hannah. So chlamydia and gonorrhea can be treated with antibiotics. However, other STIs such as HIV and herpes can only be treated and not cured. Okay, let's do one more. So you can only contract an STI from someone if they currently have symptoms. Is this true or false? Anyone know? Yes, okay, it's false. So STIs can be transmitted even when someone does not have symptoms. Wow, everyone here is already an expert. That's so awesome. And feel free to message any other questions about STIs. I'm gonna move on.
Amazing. Also, just a quick note, I know it's very confusing and it can be a little bit intimidating, and especially when people are a little bit confused about the various different STIs, that actually like scares people off from getting tested. So I just wanted to clarify that the reason why chlamydia and gonorrhea can be cured is because they're bacterial infections. And that's why Mari mentioned that antibiotics are effective for fully curing them, as opposed to herpes or HIV, which are viral infections, which unfortunately can't be cured in the same methods. Okay, So now we're going to talk about STI testing and communication. So
Really,
STI
really
testing,
quickly, sorry, Jacob is raising their hand. Jacob, do you want to unmute yourself for a question or comment?
Yeah, I just have a quick question about the previous slide and the previous true or false question. And I think I've heard somewhere that you can't, like if it's like a wart or something, like that sort of STI, you can't catch it if there isn't like an open sore. Is this true or is this completely false?
yeah, so Jacob, what did you, I think I misheard something. You said you can't catch it if it's like a blank? What
Yeah,
did
if
you
there
say?
isn't like an open sore or there isn't, it's not like actively there at the moment in terms of like warts and stuff.
Oh, I see what you're saying. Okay, so are you
Yeah.
referring to herpes specifically?
Sure, yeah, but I think like any other like genital wart stuff.
Yeah, okay, so it is tricky. There's actually a really good Instagram page about this. It's called My Boyfriend Has Herpes. And when it comes, yeah, it's pretty on the ball. But when it comes to this stuff, it's better safe than sorry because you can't be certain. Usually when you have a breakout, those are the open sores or like the open genital, like the more obvious genital warts. So it is something that increases your risk of contracting it if it's there, but you're not guaranteed to not contract it if it's not there. So like just the general policy, better safe than sorry, but what you're talking about is it's definitely a higher risk if there is an open sore like right there in the moment. Does that answer your question?
Yeah, totally. Thank you.
Okay, great. Thank you. And Mari just mentioned the name of the Instagram page in the chat in case you guys are interested. It's so cute. They have a bunch of comments and like different little tabs and stuff. It's awesome. Okay, so if nobody else has a question, I'm going to continue on. Just raise your hand if you do. So now let's talk about STI testing and communication. Testing is available for free at UChicago Student Wellness. They have an STI clinic. So testing is covered under your student life fee. You don't have to pay money for it, and it will not go on your insurance. So your parents will not know that you were tested if that's something you're concerned about. Because UChicago Student Wellness has a dedicated STI clinic, this means that they have way more available appointments in a separate area in student health services specifically dedicated for STI screening. So the resources are there. All you have to do is call to make an appointment, and at the appointment, a doctor or a nurse will ask you about the kinds of sex that you've been having or had to figure out what kind of tests that you need. Most commonly, these tests will involve a urine sample, a blood sample, maybe some swabs. So this begets the question, how often should you get tested? Which is a good question. This is different for every person. But in general, we do recommend at least once a year or in between each new partner. But we also highly recommend just talking to your doctor and seeing if they think a different schedule would be better for you or well suited for your lifestyle. It's also important to remember that STIs are way more common than you think. So having an STI is not the end of the world and does not mean that you will never have sex again. It just means that you need to receive the proper treatment and be careful about protecting yourself and your partners. So communication about your status and about how you both plan to protect yourselves is so important. Bacterial STIs, as I mentioned, are totally curable, and your doctor will provide you with all the details about how to treat and or cure an STI if you do get a positive result.
Okay, so now we're going to talk about communicating your status. So this is an important part of any healthy relationship. It might seem awkward at first, but it's necessary, and chances are your partners will like the fact that you're being conscientious about their health and your own. When having these conversations, make sure that you have a caring and open tone. Some examples of how to have these conversations are, my last STI screening was fall of 2018 after I got treated for chlamydia and I tested negative. When was your last testing? FYI, I got tested for STIs last month and I didn't have anything. Have you ever been tested? I want us to make sure we're taking care of each other. I have herpes and I know you might need some time to think about what that means. Here are some resources that helped me with my diagnosis and might be helpful for you too. Please feel free to ask me any questions. So during these conversations, try to avoid using words like clean to communicate that you or your partner tested negative. STIs aren't dirty, they're pretty common and often easily treatable. And watching our language is a great way to make our partners feel comfortable and to decrease stigma. If you want to have sex with someone, but you're not ready to have a conversation with them about your status yet, make sure you insist on using protection, a barrier method, so that you are as safe as possible. Anyone have questions?
Yeah, so it looks like there's a question in the chat. Should you get tested even if you are celibate? Okay, yes. So we would recommend for you to still get tested just because some STIs can be transmitted orally or through physical contact with someone who has open wounds, as I believe Jacob referenced earlier. Oral herpes is a thing. Genital herpes can even be passed to somebody's mouth in situations like this. So better safe than sorry. I guess it depends on what your definition of celibate is. Like if you just don't have sexual contact with anybody at all, then maybe it's different for you. But there are these little caveats that do make it better safe than sorry.
Yeah, and if you do have any questions about like what like specific sexual activity, what the risk for any like specific sexual activity you might have engaged in are, it's great to just reach out to a doctor and they can provide more like comprehensive advice based on like, your specific circumstances. But yeah, thank you so much for the question.
Great. So let's talk about communicating your status during COVID specifically. Now, the way in which these conversations are approached and framed can really dictate the tone of your conversation and how productive or unproductive they are. So regardless of if it's about STIs or COVID, communication is key. And we know conversations like these can be really hard. But we do recommend approaching them in a way that advocates for your relationship with them. I remember earlier, Hannah had a great answer to why you would want to say that you would want to stay on condoms and how you'd articulate it. And she framed it exactly this way, in which you want to advocate for your relationship with them and put your best foot forward with them. Additionally, you want to be transparent. So you want to make clear your expectations about socialization, about the ways that you're going about socializing, your various social networks / pods, and your COVID-19 status when you are potentially engaging in sexual intercourse, if that is something that you are doing. And so additionally, you want to advocate for yourself. So you have your needs, you have your wants and your preferences, and it is totally fine to make those known. It doesn't make you a handful, it doesn't make you high maintenance, it's important. Additionally, when you're advocating for yourself, you also want to discuss your COVID-19 expectations. You know, we are in a pandemic, and of course, student wellness does not encourage you to just go about being unsafe. But in the situation where you do need this advice, we do really encourage advocating for yourself when it comes to your expectations for your partner and, you know, where they wear masks, how often they have PPE, their public hygiene, how often y'all both wash your hands. That's all important to talk about.
Okay, I don't see any questions in the chat right now, but feel free to keep shouting them out or sending them to the chat. So for now, let's talk about HIV prevention. PrEP and PEP are medications that prevent the transmission of HIV. PrEP, or pre-exposure prophylaxis, can be taken in a regimen to prevent HIV contraction in HIV-negative individuals. This would you take before an expected exposure. When the medication is taken as prescribed, chances of getting HIV if you have sex with an HIV positive partner are very low. On the other hand, we have PEP, which is post-exposure prophylaxis, and this is prescribed after potential exposure to HIV to prevent contracting it. So after the fact. And this would be if you weren't taking PrEP. Both can be expensive and require diligence to take properly, so we always recommend that you talk to a doctor. UChicago students can actually get PrEP and PEP at UChicago Student Wellness, so we encourage you to make an appointment to learn more about if this applies to you. And we especially recommend Howard Brown Health. They have a sexual health clinic that also provides these services, as well as other great resources for LGBTQ plus folk. And since this is an expensive medication, they offer sliding scales to help with the cost.
Okay, so now let's talk about barrier methods, and this is essentially how you can prevent the transmission of STIs. Barrier methods are used during sex, which includes vaginal intercourse, anal intercourse, and oral sex. And essentially what they do is provide a physical barrier between you and your partners. So barrier methods prevent the transmission of STIs, but they also prevent pregnancy because they prevent the sperm from meeting the eggs, and they can be used along with hormonal birth control to provide that extra protection and that peace of mind. So we have 3 different types of barrier methods that we're going to talk about in depth in this presentation. The first is internal condoms. Internal condoms are worn inside the vagina, and we're going to show you how that works and the advantages, disadvantages of this. External condoms are worn over a sex toy or penis rather than inside the vagina. And finally, dental dams are barriers between the mouth and a vulva or anus during oral sex. So this can prevent other forms of transmission of STIs that aren't necessarily penetrative. So barrier methods are cheap and they're available over the counter. And when you're a UChicago student, they're actually free. You can get them free at UChicago Student Wellness Services. And also your wellness czar should have your house stocked with emergency condoms. As a former wellness czar, it's not fun when they disappear all in one night. So preferably you do access the ones from UChicago Student Wellness Services, but it is good to know that they're there. Where also there are a variety of kinds to choose from. So when I say external condoms, that actually includes a pretty wide variety of different types of external condoms, and that depends on your preferences and what kind of sex that you like. Barrier methods are awesome. It's just that there's the downside of user error. They're way more prone to user error if you're concerned about potential unwanted pregnancies. That's why it's really important to know how to use them properly, and that's why we're taking the time to do a demo in this presentation. Also, I think Alex mentioned something in the chat. She said that if somebody has an STI that involves open wounds, and if that person touches the open wound and then touches you or other things that may touch and you touch your eyes or mouth, then it is possible for the STI to be transmitted. Sharing drinks or food can also transmit an orally transmitted STI. So better safe than sorry. I feel like it's like the 5th time I've said it, but I don't mean to be prescriptive.
Also, really quickly, just a note on condom distribution during COVID-19. So basically all the condoms from Chicago Student Wellness have been distributed to the houses, and their RHs are deciding, or have decided already, the best way that each house wants to distribute those condoms. So if that's through, you know, like the boxes in the house lounges, or if that's some other way, you could just ask your RH or in your house Facebook group, something like that, because I know houses are doing them different based on what works for them. And then also, if you ever go to the new Chicago Student Wellness Center, there's, I'm pretty sure, like condoms, but also tampons and pads and packets of lube, just like in dispensers in the bathroom for free. If you ever find yourself there for like an in-person visit or something, they're also over there.
Thank you, Alex. Is anybody curious about the varying effectiveness of the different kinds of condoms? We can go over that too, but if people aren't, then it's fine. We can just move on. Okay, we'll move on.
Yeah. Okay, so proper usage. Use a new condom every time you have sex. So every new like round of sex. Don't reduce, reuse, recycle here. Only use 1 condom at a time. 2 condoms or double bagging it is not effective because the friction will cause them to tear, or more likely to tear. Use the right kind of lube. Most condoms come pre-lubricated, but lube can be a great addition to almost any kind of sex act. So you have water-based lubes, which are in the clear packets, in the safe sex packs, or that you might find at the Chicago Student Wellness Center, are safe for all use. Silicone-based lubes are not safe to use with silicone sex toys because they'll degrade the silicone. Oil-based lubes like lotion, Vaseline, and coconut oil are not safe to use with latex condoms. And all of the lube that you would get from Student Wellness are safe to use with all of the condoms. So they don't provide any oil-based lubes. So make sure you store your condoms safely or your barrier method safely, not somewhere hot or too cold, like not in your car. And if you keep them somewhere where they might encounter a lot of friction, like a wallet or your purse, be sure to replace them often. Before using, always check the expiration dates. Most importantly, always use a condom when you want to. Don't accept excuses. So we're gonna do some role play for what someone who might, so what would you say to a partner who tries to convince you not to use a condom? So maybe I'm the person who doesn't want to use a condom and I say, it's too small, this condom won't fit on my gigantic penis. What would you say to me? Feel free to unmute yourself or throw it in the chat.
Cameron says it stretches.
Yes. Yeah, actually most regular size condoms fit most people. And also internal condoms are never too small. Yeah, they stretch. It doesn't feel good. What would you say to that?
Neither do STIs.
Oh yeah, STIs do not feel good. Or get a better kind, yeah. They have some that are ribbed, which could feel good if you have a vagina. Having a lubricated one helps. They make condoms that are flavored, which could be fun for oral sex. Although flavored condoms and people, if you have a vagina, could cause a yeast infection due to the sugar, so it's good to check. Okay.
Also, on the note of different kinds of condoms, what Cameron says is actually a really good point because they do have different kinds of condoms. If the condom's too small, it can be uncomfortable, even though it shouldn't be. Usually it's not. And also there are ribbed condoms maximizing different kinds of pleasure, many, many options. And Will says it feels a whole heck of a lot better than chlamydia, which is a fantastic point.
That is so true. Okay, and then one more. I don't have one. What do you do if someone says, I don't have a condom? You might say, I do. Let's go get one. Or let's go to Walgreens. Let's go to CVS. Or they give them out for free in the, yeah, it looks like we aren't having sex tonight. That also works. It's also like hot Walgreens day. Everyone loves Walgreens. These are all great scenarios. Yeah, it's totally okay to not want to have sex without a condom. It doesn't make you high maintenance. It just means that you're looking out for what's best for you. Okay, thanks everyone.
Also, I noticed that there's a question about why males tend to use condoms, or people with penises, more often than people with vaginas, and is it easier? Well, we'll show you in the demonstration right now about how to do both, and it's up to you, really. You know, and maybe it's easier for you to use one over the other. Totally fine to have a personal preference. Internal condoms were also invented and distributed in like a commercial way later than external condoms. So it could also just be the general inertia of the thing.
Yes. Yeah, I would say that like in the media or wherever in like TV, like when people are using condoms, it tends to be external ones. So I feel like that's just where people's mind jump to, but internal condoms also have a ton of benefits. So Chicago Student Wellness provides them both, so it's a good chance to try them both out.
Mari, you want to show them the external
Yes.
condom demonstration first?
Yes, let's go on. Okay, so I'm gonna stop sharing for this. Okay, so we have our condom. So this is an external condom. And the first thing we want to do is we want to get consent. That's the first thing before any sex act, is to make sure you have consent. And then the next step with a condom is you want to make sure that it hasn't been punctured in any way. So the way to do this is you can kind of just feel it between your fingers. And if it hasn't been punctured, there should be like a bit of an air bubble. So like some resistance that you can feel. And also if it's a lubricated condom, if it's punctured, there might be a lube on the outside, so it'll be wet. Okay, and then the next thing you want to do is make sure it's not expired. So you, on this condom, the expiration date is just listed on the side in black ink. So just make sure it's not expired. And then your next step is going to be opening it. So a few things to keep in mind when opening the condom. Don't use scissors, don't use a knife, don't use your teeth, just use your fingers. So, and the reason for this is when you're opening it with your fingers, you'll notice if you accidentally rip it. If you just cut it open with scissors, you might cut it open and not notice. So that could lead to a contraception failure. So I've opened the condom, and before you put it on your sex toy or your penis, you want to make sure you know what the right way is. This is the wrong way. So we say wizard hat and beanie. So we all want to be wizards. So right now it kind of looks like, if you use your imagination, it looks like a beanie. And so you can see that, like, if you kind of pinch the tip and try to roll it down, it won't roll very easily. So the correct way is it should look like a wizard hat, and there should be like a little brim. It's kind of hard to tell over Zoom, but if you want to practice beforehand, that's a great idea, just to make sure you get it right. Okay, and so you've got it the right way. So you want to take I have a demo here, demo model right here. Take your sex toy or your penis or whatever you're going to put the condom on, and kind of rest it on the tip, and make sure you figure out what the right way is before putting the condom on whatever you're going to put it on, because if you put it on the wrong way, and you touch like the wrong side to the penis or whatever, there's going to be fluid exchange. So if you do find that you've done that, throw it out and get a new one. So important to always have a few condoms on hand. Don't just have the one. Okay, so this is gonna be a little tricky, but so you place it on the tip and make sure you pinch the tip to make room for like any ejaculate, so it doesn't just like explode and break. And then just roll it down, and it's on. And so once you finished using the condom, this one's not lubricated, so it's a little hard to get off, but this looks a lot more painful than it actually is. So yeah, so it's off. Take it off away from your partner so you're not actually dripping. Yeah, well, fluid everywhere, tie it up. It's not messy, and then dispose of it. And make sure you're not throwing it down the toilet, because you will clog the toilet, and then you'll get in trouble with your whole dorm because you are the person who clogged the toilet with a condom. So just throw it in your trash and take your trash out soon, because that's body fluid. So it's a little yuck, but well, not yuck, but you don't, just for people who might come into your room, probably won't want that in your trash can. Okay, so that's external condoms. So I know Kat has a demo.
Yes. Okay, guys, I'm going to be talking about the internal condom. And I understand there is an activation energy to doing something that's not necessarily mainstream or something that you're not familiar with from watching Netflix. And that's totally fine. But internal condoms actually have a lot of benefits to them. So I'm going to talk about those right after showing you how to use them. So before opening your internal condom, you should get consent. It's like our trick question normally, but it's a little bit harder to be interactive now. So after you get consent, you can check the expiration date. Now this is what an internal condom looks like. And when I'm checking for the expiration date, all I gotta do is just unfold it a little bit. And you can see it says it right there. So it's very easy to see. This one expires in November 18th of 2020. So quite close, actually. So additionally, there is no air bubble to check with this. As Mari mentioned, you can kind of like pinch an external condom, see if there's a space there, some pressure exerted against your fingers. That's not the case for these. However, it is very easy to tell if it's been ruptured or if it's been damaged in any way, because the internal condom is very lubey. So if it's been ruptured in any way, then you're going to get a lot of that lube on the outside of it. But this is, it's not lubey at all. So it's very nice to know that it hasn't been ruptured at all. So when you take it out of the package, I have this one, I've already cleaned it just because it's very lubey. I didn't really want that on my hands while I demonstrated to you guys. So I just rinsed it off already. And you can see that there's an inner ring and there's also an outer ring. So you can actually take their inner ring out when you want to use it for anal sex. But if you want to use it for vaginal intercourse, then you want to keep it in. So don't mess with it then. So basically, when you're inserting this internal condom into a vagina, you want to pinch this inner ring, the one that's inside of it, into a figure 8 with your fingers. And you want to do this with one hand, like that. And then I have my little prop over here. But after you do that, you want to take it pinched into like a little infinity sign, and you're going to insert it into the vagina. And it's a little bit difficult just because this is a demo, it's not the real thing. But basically, if you push it in with your hand, you don't actually want to use this again, just because it's actually been exposed to potential sex fluids, and you don't want to expose your partner to that by touching the inside of it. So now that you've already used this hand, you're going to switch hands. So now you're going to use 2 fingers on your other hand, and you're going to push that little inner ring, and you're just going to push it in there. And if you push it in there correctly, it's going to pop into place. You see how it's popped into place? Right up against the pubic bone. So that should feel good. It shouldn't feel like there's something poking you. If it is, then it's probably in a little bit of a wrong position, poking your cervix. So move it around a bit until it feels better with your other hand, the one that hasn't been exposed to potential fluids. And if you're having a hard time inserting it, you can also just ask your partner to help you. Make sure that any object of insertion goes into the condom, not around it. And when you're trying to remove it, you can just take it, twist it, and then pull it out. And it's very convenient, and then dispose about it in the garbage the same way that Mario was demonstrating. So a great part about this is, there is a power to being a person with a vagina and being able to wear the condom. We've had discussions about people not wanting to wear condoms, usually people with penises or people using a sex toy. And in the situation, there's no discussion with that. You already have it in. You can put it in hours earlier. It's not an in-the-moment thing that has to interrupt foreplay. You can literally put it in the afternoon and then use it in the nighttime with no fuss whatsoever. And it also provides more STI protection, actually, because it covers the labia. And it's also very empowering. So lots of pluses to it.
Yes, thank you so much, Kat. Okay, so our last one is on how to make a dental dam from an external condom. So as we talked about earlier, dental dams are used as a barrier between like your mouth and someone's anus or vagina or whatever surface you want to prevent skin-to-skin contact. So you can buy dental dams from the store, but they're pretty expensive and they're a little bit harder to find. And again, we give out condoms for free, so why not just get a little crafty and get a dental dam? So again, reiterate, consent, expiration, not punctured are the first steps. And I already opened up the condom just to go a little faster because we're cutting short on time. So to start, you take your scissors. This is the only time you use scissors in your condom. And you want to just snip the tip off, just the tip. Okay, and then, so I have a little I guess it's like a loop right now. And then you just cut up the side. So your goal is just to make a rectangle of latex. So just cut up one side and then unroll it. And then you just have like a little square of barrier protection. It's hard to unroll this because it's not lubricated. But yeah, so it will unroll all the way, and then you just have this barrier protection, which is great because we talked about like penis and vagina intercourse or penis and anus. It's not the only way to spread STI. So it's good to just make sure, take the extra step and make sure you're being protected. So those are our 3 demos for today. I'm going to start sharing screen again, and if anybody has any questions, feel free to shout them out. Otherwise, let's see, we have some resources. So we have plenty of campus resources, and since we're pressed for time, we won't kind of go over all of them. But if you want to take a picture of these or a screenshot,
if you want to do the thingy, they can just see your notes, but I mean, that's also okay.
Oh, sorry.
No, it's okay.
Everyone can see our notes, okay.
If it's a little too complicated, don't worry about it.
Okay.
I know we're over.
Yeah, sorry, this is our first time giving this presentation with, okay, and then, okay,
Yeah, good.
I'm good. No notes, okay. Let's see. Can you see my notes?
Yeah, but I think it's fine.
It's fine. We don't have any like secret information that we're trying to hide from you guys.
We're talking smack in our notes.
Yeah. No. Yeah, so we're just gonna finish with some resources. Let me get to the back. Okay. So yeah, UChicago Student Wellness is a big one because it's meant for students. So we've got the number up there. There's Planned Parenthood. There's one in West Englewood, Chicago Women's Health Center, Howard Brown Health, which is on 55th and Lake Park across from the Walgreens. And they're also doing walk-up COVID testing. So that's also great. For me, we've got some healthy relationship resources. So there's the SADOC or the Sexual Assault Dean on Call. And we've got the Deputy Title IX Coordinator up there, Renee DeSato. And somebody shout if I'm going too fast with these. And you can also call UChicago Student Wellness. Yes. And then we've also got some domestic violence and sexual assault lines up here. And again, if people want to take a picture of this with their phones, that's really okay. Does anybody have any questions about any of these resources or want me to go back to got the sexual health one?
Also, these will be posted on the Chicago Student Wellness In Touch part of the website super soon, just like having some technical difficulties doing that. Also, just to note for these last 2 slides of resources, we just want to make it known that we understand that police is not and historically has not been a safe resource for people of color. That's why we want to be transparent and let you all know that certain university affiliated resources may contact UCPD or CPD if the student expresses they are in pertinent danger. So for example, police may be contacted when a student opens up about self-harming or suicidal thoughts. And we just want to assure students that there are resources available to them if they would like to seek help from those that do not involve police. So the last 2 slides are ones that for sure don't contact any police, just so you all know.
Thank you, Alex. And so I think those are all, if you want to take another picture, these are the mental health and substance abuse. Big one to know is the National Suicide Prevention Hotline. And yeah, as you can see in the notes, what Alex mentioned. And so we also have, Kat, you want to take it away?
Yes, okay, so we have this little form. If you guys could fill it out, it would be greatly helpful for us, just because, as Amari mentioned, this is our first remote workshop. So we've done a lot of adjustments to try to figure out how to still be informational and hopefully interesting for y'all. So if you could just go to that tiny URL link and let us know what you think. And if maybe you have any questions, concerns, any suggestions, we would be so open to hearing that. And it's really helpful for us to get your feedback. And besides that, this presentation is basically done. Thank you all so much for coming, for your patience with the little technical difficulties that we had. We'll stick around a little bit in case you guys have any questions that you want to direct message us, let us know about. And yeah, so please fill out that form if you can. It'll only take like 2 seconds.